Medication calculation is often quite difficult for the student nurse. The reason for this difficulty is that the student attempts to learn multiple formulas of calculations that are often dependent on specific conversion criteria. Today we will learn the method of dimensional analysis. This method is considered universal to any medication conversion and any client that requires a dosage calculation. By the end of this lesson, you should be able to be reminded of the importance of medication safety when calculating meds. You will develop a step-by-step process in the understanding of dimensional analysis. And finally, by the end of this lesson, you should be able to successfully complete the practice problems in the formative assessment.
What is dimensional analysis? It's the one accurate, logical method to use for calculating medications no matter the client type you have, no matter the medication dimension that's available to you. If you're needing to give a client something in milliliters, teaspoons, ounces for liquid medications, tablets, capsules, milligrams, kilograms, IV fluid, time, this is the one universal method that can be used for any of those. Anytime there is a weight-based drug dosage that needs to be calculated, there's always a risk for error, especially in the pediatric client. Every year, at least 1 million individuals suffer some type of medication error injury. At least one death occurs every year as a result of these injuries. Dimensional analysis is one method that helps the nursing student not be so confused with all the multitudes of methods for memorization. So let's get started. I'm going to help you through a 4-step process on how to apply dimensional analysis for dosage calculation. But you do need to remember your conversions. If you don't, you'll need to look those up. So let's get started. But remember, don't memorize the steps. Understand the process. And it all begins with understanding what label, unit of measure, milligrams, milliliters, ounces that you need to administer to your client.
Before we begin the 4-step process, let's discuss the equation. To set up the universal equation, the left side is always the amount to administer. What is the unit of measure for the dosage unit? How much are we supposed to give the client based on the provider's order? The right side of the equal sign is the supply that you have on hand in the form of a fraction. The numerator is the same as the unit of measure or the dosage unit. The denominator is how the dosage is supplied. Next, to continue the equation, we input the conversion factor in such a way to cancel out the unwanted labels or units of measure. For example, milligrams, milliliters, teaspoons, ounces. The conversion factor is the unit of measure that allows you to convert the unwanted labels to achieve the unit for the ordered dose. You may have to use several conversion sequences to cancel out all of the unwanted labels. You must know your conversions though, or look them up. Now that we've established some foundation, let's make this appropriate for nursing practice. Step 1. Unit of measure. The first step is always to determine the unit of measure that is needed based on our order. We will begin with what is prescribed. For this example, acetaminophen is prescribed 650 milligrams by mouth every 4 hours as needed. Supplied to you is acetaminophen 325 milligrams in 1 tablet. Now follow the whiteboard example before we continue. Let's continue setting up the equation. Set up the left side of the equation so the unit of measure that is needed to administer the correct dosage is in the numerator. In this case, the medication is to be administered in tablet form. Moving on to step 2, determine the conversion factor or the concentration of the medication that is supplied. I'll discuss it and then we'll show you on the whiteboard again. To continue our example, set up the right side of the equation by placing the same label in the numerator as the left side to maintain what is needed for administration, in this example, tablet. For this example, place a concentration of what is supplied in the tablet per milligram format. You have supplied per tablet 325 milligrams. Now watch the whiteboard before we continue. Now it's time to get rid of those unwanted labels in our third step. We'll continue to place information in an effort to cancel out the unwanted labels or units of measure, leaving only the units that we will administer. Continuing with our example, our unit of measure for our client is tablets. Therefore, we know that 650 milligrams are prescribed, and we have 350 milligrams in each tablet. We want to administer tablets and not milligrams for our unit of measure. So the equation continues by placing 650 milligrams in the numerator in order to cancel out the unwanted milligram labels. Should there be any other unwanted labels, if there were a different problem for you to calculate, this process would continue until you are only left with the units of measure or labels that you will administer. Now watch the whiteboard while this process goes on. Finally, we're at our fourth step, where we complete the equation. We simply do the math. Now that your labels are canceled out, except for the appropriate one for the administration of your medication, in this case tablets, multiply all of the numerators across, then all of the denominators across, then divide the total number by the bottom number for your final answer with the correct unit of measure. Your answer is that you will administer 2 tablets to the client, achieving the prescribed amount. Watch the whiteboard as we complete our problem. Let's recap. Student nurses should focus on understanding the method instead of memorizing the steps to dimensional analysis. Remember step 1. Start with the label that is necessary for the answer. What dimension do you need to administer the correct medication to the patient? This will help you with the setup. Then, using the same numerator, how is the medication supplied? Then, build the calculation until all labels or units of measure that are not needed are canceled out, placing these numerators or denominators sequentially to get rid of what you do not need. Lastly, perform the arithmetic to arrive at the correct answer. Do not round any numbers until you obtain the final answer. When you follow this method, it is accurate for every unit of measure. Your responsibility is to understand the conversion. It is always okay to look these up before you proceed with medication administration to keep your clients safe.
So, there you have it, and now it's time for your practice assessment. But before we get started, I want us to practice one more time with one more problem, and I'll walk you through the 4 steps to make sure that you understand the method. At the end, you will do a practice assessment, which is to help you learn and help you to perfect your method. And you will receive immediate feedback, but those instructions will come at the end of this presentation. So let's practice once more.
Now let's go over our practice problem. The order is for cephalexin 1 gram IV piggyback every 8 hours. The supply is cephalexin 1 gram in 50 milliliters of D10W to infuse over 30 minutes. We must remember that IV pumps administer infusions in milliliters per hour, so this leads us to our first step to determine what label is needed to administer the medication to the client. How many milliliters should we deliver in an hour to give the client their medication over 30 minutes? Step 2, using the same numerator of what is supplied to us. So how many milliliters in an hour will deliver 50 milliliters in 30 minutes? Step 3 is places to cancel. What label do I not need? Since I need to deliver the medication in milliliters per hour, I do not need the minutes label. So, how many mils in 1 hour will deliver 50 milliliters in 30 minutes? And I don't need minutes, so to cancel it out, multiply times 60 minutes in the numerator in 1 hour. Cancel out the minutes, and then do the math. Multiply all the numerators, multiply all the denominators, and then divide the numerator by the denominator, giving the answer that I will set my pump at 100 milliliters in 1 hour, which will deliver 50 milliliters of the medication to the client over 30 minutes. Now that we're done practicing, move ahead to your formative assessment. On your Google site, follow the link, and it will give you instructions on how to complete so that you'll receive feedback on how to perfect dimensional analysis.